how do we get a gorgeous neckline without a big fancy facelift. It's not possible for everybody, but in select patients, we can give them a MIMS procedure, which stands for Minimally Invasive Mastoid Sling. So a patient comes in, she looks like this, or he looks like this. They've really got no neck definition. Many times it's from excess adipose, which is a fancy word for fat, in their neck. They may just congenitally be this. A lot of patients will come in and say, everyone in my family is like this. They don't have any neck. I want a jawline. I want to see my gorgeous neck. All right, how do we do it? First, you have to break down what's going on. It works very well in patients who do not have a lot of loose excess skin. Therefore, it's not really great for my 70-year-old patients who come in. Clearly, you're gonna have a lot of loose skin. This is the perfect wheelhouse for a 20, 30, 40, 50-year-old patient. They're our best candidates for this because they don't have nearly as much loose skin. They just have a little bit of saggy tissue and some excess fat in their neck. So the only incision that's made is right back here. It's often even a little bit closer behind the ear, so it's not even seen. I'm just drawing it here so we can visualize it. We need to understand what the anatomy is. We need to know where your jawline is. So I draw on the patient where their jawbone is, and that helps me figure out how we're going to define exactly where we're going to go. Then I come in here and I liposuction the fat out of here so that the tissue is now a little bit saggy. If you stopped right there, probably gonna have an unhappy situation because you got all that loose skin. We need to bring that skin up here. How do we do that? Make several little pokes down here and it comes up to here. This is the powerful part of the MIMS procedure because back here is what we call the mastoid bone. Take your finger, put it back behind your ear. You feel that bump area, that bone? That is your mastoid bone. There's the mastoid bone. Over any bone, there is dense fascia periosteum. There's very, very tough tissue that is holding the bone tissue to the rest of the soft tissue of the body. We're going to manipulate that and use it to our advantage. So we're gonna thread a suture into here, along here, up into here, and then we're gonna lift up underneath here and go around that mastoid fascia and create what we call a mastoid sling. And so that is basically our anchor point. When I'm in surgery, I can pull on that and actually lift the patient's head right up off of the operating table. It's so incredibly strong. So this suture, when we go in here, goes along here and then around that mastoid sling. We do this to the other side as well. And in doing so, after we've liposuctioned, we're able to pull tight on it like the reins on a horse and tighten up that tissue so that we wind up with a result that looks like this. By pulling tight on that suture, now this entire soft tissue envelope down here has been brought upwards. So by pulling tight on this soft tissue envelope, this entire area underneath the jawline has been brought right up along the neck area so that we recreate this gorgeous jawline. There's her bony angle of her mandible that has been very well clearly established, and we've been able to tighten everything up here. And because we're anchoring to the mastoid sling, this is where all the magic happens and where it's so incredibly powerful because you're able to pull so tight that you're able to retract all the tissue, tie it off, and it stays there forever because it's a permanent suture. Here also is more of the magic is that I don't just stop there. That is a permanent suture, but I add on 2 more absorbable sutures and those get tied even tighter than that. And that causes a little bit of puckering of the skin, a little bit of puckering here. That little bit of puckering will last for about 1 to 2 weeks until those sutures dissolve and go away. But that really helps maintain and ask that little bit of scar tissue to help hold that contour along the neckline up into that newly positioned contour underneath the jawline. That's one of the little pearls that I've added to this procedure that I think is so fantastic. If those little puckers maintain beyond 2 to 3 weeks, we can come in with microneedling, which are needles that oscillate back and forth at 100 times a second, and they're like tiny little jackhammers, and they can break up that puckering and soften and settle that in. So this is the MIMS procedure, Minimally Invasive Mastoid Sling, that allows, in the right patients, generally younger, tend to have a little bit of a congenital heavy neck, that they can have an incredible result that really reveals and shows a dramatic jawline, which is what many people are looking for to give them that youthful appearance. Hope you found this helpful. Thanks so much.